Hi, and welcome back. Today I thought we'd talk about colonic dysfunction. Well, what's colonic dysfunction? Actually, it occupies a big area of discomfort and morbidity and reasons for presenting to the physician. And that's when you have a change in your bowel habits, which could be diarrhea or constipation. And a lot of times it's associated with abdominal distension, bloating, and with this can come with pain and discomfort. So when we talk about diarrhea and constipation, there is a description which says that if you have more than 3 bowels in a day, or if you have one bowel movement less than every 3 days, that this could be, that this is classified as constipation. But really, you have to look at it in the long term. Like if you've had one way of defecation for years and years, and then this has changed over the last 3 to 6 months, this then requires further investigation. So I think this is a better way of looking at it. So what can be involved in the change of your bowel habits and with your gut? Well, first, again, we can describe it as a functional problem or an organic problem. And functional, once again, means that there's something wrong there because the patient's obviously having symptoms and complaining about it, but you just can't put your finger on it, and you don't have an obvious diagnosis. In other words, it's not this, not that, it's not that. So you say that it's functional. And a lot of times this will be because there's some sort of a dysmotility in your bowels. So the contractions are maybe off. Maybe there's some sort of microscopic barrier that's disrupted in the gut, that's causing symptoms and some sort of inflammation, which is in some studies have shown this. Maybe it's your gut flora. But there's something there that we just can't put our fingers on, but that's giving symptoms. And then you have organic causes. Well, organic causes, you have to first see if this is acute or chronic. And here we're talking about something chronic, because acute can be just from an infection. Usually that will resolve if it's a bacterial infection within 2 to 3 weeks. If it's longer than that, then it's really not an infection, unless you're talking about parasites. An infestation that can last for a longer period of time. So chronic change in your bowel habits could be from an inflammatory process. Here we're talking about Crohn's disease and ulcerative colitis. And once again, I'm not going into detail with this, and we'll, in some other presentation, we'll go into these different disorders. It could be from diverticular disease, where you get pockets in the bowels, and sometimes they get infected, or sometimes even if they don't get infected, they can cause symptoms. And Western populations where you have a lot of meat in the diet, and constipation is a bigger problem, you get more diverticular disease. You can have problems with bile, like if somebody's had a cholecystectomy, the bile, well, what does the gallbladder do? It conserves bile, and then when you eat, it sends it to the duodenum so you can get your digestion. If you don't have your small bowel, the bile is flowing continuously, and when it goes into the large bowel, it can disrupt it and cause diarrhea. Sometimes you can go to the stomach and cause indigestion and so forth. Sometimes you can get ischemia, like not enough blood supply to the bowels. That could be from medication or from certain disorders. And you can get, obviously you have to make sure that we're not dealing with some sort of a tumor. The body, everything is connected. So you also have to make sure there's not some other systemic disorder that's affecting the bowels. What could that be? Well, for example, your thyroid. If your thyroid is working too fast or too slow, then it can affect the bowels. Sometimes something like diabetes mellitus can affect both your stomach and your gut in terms of motility and so forth. So you want to make sure as well that there's no systemic disorder. What kind of investigation will you do? Well, first, you want to see if there's any red alarm signs. Like if there's rectal bleeding, then you want to make sure there isn't a tumor or some sort of inflammatory process, like I said. It could be something very simple as well, such as hemorrhoids, obviously. If the patient has lost weight, if they seem pale, and if something is just not right, then you really need to do further investigation. What kind of investigation? Well, first you want to do some regular blood work. You want to make sure that there's no systemic disorder, that your blood counts are normal, and so forth. You may want to do a stool test to see if there's parasites. You may want to do an abdominal ultrasound or CT scan. It all depends. One test that we usually like to do, especially when there's chronic disorders, is a colonoscopy. And colonoscopy is when you take a look at the large bowel with a light. So basically, the patient comes prepped, having their bowels cleaned, and then we give medication intravenously so they don't feel anything. And with a light, we examine the entire large bowel. We go to the end of the small bowel, and we take biopsies as well, because you can see things in the biopsies sometimes, even if everything looks normal, where there's a disorder that you can do something about. And at the same time, if there is a polyp or whatever, that can be removed, and if there's some sort of other formation or a tumor, you take biopsies and so forth. So colonoscopy is a very good tool in terms of both diagnosis and sometimes treatment in chronic disorders of the small or large bowel. So that's basically what I had to talk about today. Hopefully later we'll go into these different disorders and tackle them one by one. Have a great day.